a record high number of cases. Yesterday, we had a record high number of deaths. Dr. Dobbs cannot be with us today, so we have our state epidemiologist, Dr. Paul Byers, and our Director of Health Protection and Senior Deputy at the agency, Mr. Jim Craig. So I'm going to first have Dr. Byers talk a little bit about what's going on, and then Mr. Craig will talk about some exciting news about vaccine and vaccine sites coming up next week. So Dr. Byers, would you like to go ahead?
Absolutely, and good morning, everyone, and thank y'all for joining us. So, as Liz indicated, we are reporting out over 3,000 additional cases today. That's actually 3,023 cases. If you look, there was a minimal delay in reporting over the Christmas holidays, but honestly, guys, we are still seeing a lot of transmission out there, and this represents a lot of cases that we're still seeing and are being reported. If you look at today's deaths, we're reporting out an additional 29 deaths, but sadly, yesterday we reported out 85 additional deaths. By far the largest number of deaths we've reported out in one day. So we are still seeing a lot of transmission. It is still bad out there right now. And, you know, we haven't even made it through the holidays yet. So we want to remind folks that, you know, we've got some exciting news about vaccine that we're going to continue to talk about. But we still need folks to wear a mask. We still need you to stay 6 feet away, avoid those large gatherings, stay within your nuclear family, except for those essential functions that you need to go out and do. So please, we encourage everybody to continue those actions as we go through the holidays. We are still seeing some stress on our healthcare capacity. You know, we've got over 1,300 confirmed COVID cases in the hospital right now. And when you look at folks in the ICU, that's over 300 confirmed cases in the ICU, and of those, more than 200 are on a ventilator, and that includes one child. So, you know, these increased numbers of cases that we're having translates into more hospitalizations, translates into more deaths. And so I would encourage everybody to remain vigilant and continue to be serious about limiting transmission. But we do have a foot in the door with vaccine, and we've had vaccine in Mississippi now for a couple of weeks. And right now we are still in phase 1A. Just as a reminder, that's a targeted priority of vaccination for healthcare personnel in the state and for residents and staff at long-term care facilities. We have already distributed out a lot of vaccine in both of those efforts, to hospitals, to long-term care facilities, to continue to target those personnel. And, you know, moving forward, we want to continue to expand access and availability of the vaccine to those healthcare personnel. And when we think about the importance of healthcare personnel, these are the folks who have a high risk of exposure, so we want to make sure that they're protected. These are the folks who are taking care of our sickest folks and our patients, so we want to continue their capacity to stay on the job. And by vaccinating them and protecting them, we also prevent transmission from those individuals. So, like I said, in an effort to continue to expand the availability of this vaccine to all healthcare personnel in the state, we are announcing now that starting next week, we will have vaccination clinics at 18 sites throughout Mississippi, targeting specifically any and all healthcare personnel. And this is a broad umbrella. We want to make sure that we get those individuals who are in healthcare settings vaccinated. That includes folks like emergency medical services personnel, obviously nurses and doctors. It includes dentists, and any of those administrative and support staff that are working in hospital settings, in clinic settings, in healthcare settings. And this will continue to be important for us. I want to let y'all know that we have received and distributed almost 120,000 doses so far in Mississippi. And that includes doses that we're distributing to our drive-through 18 sites throughout the state. That's more than 90%, or about 90% of the doses that we've been allocated so far. And remember, when we look at administration of vaccines, when we provide these allocations to locations and settings throughout the state, when doctors, when hospitals administer this vaccine, they need to report it back into our immunization registry. And so far in our immunization registry in Mississippi, more than 17,000 individuals have been vaccinated with a first dose so far. And that represents those healthcare personnel and some long-term care settings. So I'd like to turn it over to Mr. Craig to discuss how we're going to roll out these 18 clinics and the logistics behind that.
Yeah, thank you, Dr. Byers, and thank you all for being with us a little bit this morning. I would like to share some of the information about these 18 sites. As Dr. Byers said, beginning Monday next week, January 4th, we'll be opening 18 clinical drive-through sites throughout the state. Now, we're leveraging our existing testing infrastructure. If you're familiar with our drive-through testing, we provide in every county in the state of Mississippi, where many Mississippians can come and receive free testing if they're symptomatic or if they're a contact to a confirmed case. And in some cases, school teachers, child care workers, first responders, and others that need to be tested can come to these locations. The drive-through model has worked really well. In fact, we're testing over 2,000 folks almost every day in Mississippi through those drive-through locations. We're leveraging 18 of those locations, some of the ones with the higher throughput, to be able to provide these vaccination opportunities in a drive-through format for healthcare workers. I'm going to share a map just so you'll be able to see where these locations are, and then I'll tell you a little bit more about. Can everyone see that map, Dr. Byers?
Yes, sir.
All right. So you'll notice these drive-through locations, the triangles in the county box are the locations in each of the geographic testing regions that we have. And we have 9 of these geographic regions that we do testing in. We've provided 2 sites, and in most cases, the high volume sites for these vaccination efforts to continue. They're very much like we use UMC as our partner to schedule testing. We will use UMC as a partner to schedule vaccinations. These sites require an appointment, just like we do for the testing components. So individuals need to go online, and the website is covidvaccine.umc.edu. And there they will be able to register for an appointment at one of these 18 sites. For those that like to look at information a little bit different, let me share another presentation of the data. So here are the counties, the 18 counties that we'll be operating in, and the days that we will be providing vaccination opportunities in those counties next week.
Mr. Craig, we can't see that. I think we may have to stop sharing and share again.
All right, let me do that right quick. All right, can you see it now, sir? All right, so these are the 18 counties listed out along with the dates of next week when we will be in those counties providing vaccination opportunities. And those are the ones that individuals will be able, healthcare workers that are eligible can can schedule an appointment on any of these days in any of these sites, not just where they live. They can go to areas where they work or other areas surrounding them. So signing up is, again, at covidvaccine.umc.edu, and we definitely want to thank our partners at the University of Mississippi Medical Center for working with us in both the testing effort as well as the vaccination effort. At these sites, very similar to what you see in testing, there will be public health nurses to assist in the administration of the vaccine, as well as Mississippi National Guardsmen that are vaccinators. Those particular vaccinators are some of our combat medics from the Army National Guard, as well as medical personnel from our Air Guard that will be assisting in the vaccination efforts at these locations. So with that, that's a little bit about the good news. Like Dr. Byers said, it's a light at the end of the tunnel, I believe, for many of us in this pandemic, this terrible pandemic that we've been in. So we're very, very happy that this opportunity is available for healthcare workers, again, in 1A, to receive this vaccination. With that, Liz, I'm going to turn it over to you for some questions from the group and see if we can give them some answers.
Okay. Can you do me a favor, Mr. Craig, and get out of that?
I can.
Okay, wonderful. Okay, so I think y'all have addressed some of this, but I'm just going to go ahead and read them. Kingfish from the Jackson Jambalaya, is asking about the 4,500 doses that the New York Times reported, which we know is not accurate. Did you not say that 17,000 Dr. Byers have already been vaccinated with the first dose?
Yeah, that's correct. And it's important to remember that, there can be a delay in entering that data into our immunization registry from the hospitals and the facilities that are out there doing the vaccination. And so there's going to be some inherent delays. But it's also important to understand that number is updating constantly as we get more entries of vaccinations administered into that system. And when we looked at where we were this morning, 17,410 vaccinations had been administered so far in Mississippi. We are going to be putting that data up on our website later today. So I encourage everybody to look for that. It'll have some demographic information and have the number of doses that have been reported administered on a weekly basis. And we anticipate that number to continue to grow in the coming days to weeks.
Okay, the next question is from Connor with the Enterprise Journal. Have vaccines started arriving at nursing homes? What is the distribution schedule for those places around the state? So, Dr. Byers, why don't you explain the pharmacy partnership and then talk a little bit about how the long-term care residents and staff will get their vaccine?
Yeah, absolutely. So this is a federal pharmacy partnership that we have with CVS and Walgreens, and we have allocated doses to that program for both the nursing homes, and that includes the nursing home residents and nursing home staff, but also other long-term care facilities in the state, like assisted living centers and personal care homes, to make sure that vulnerable population that has been hit so hard during this pandemic is protected out of the gate. We do understand that some of those facilities have already started receiving the vaccinations. We also know that many of them have been contacted by CVS and Walgreens to make arrangements for when their vaccinations will begin. And this is really going to roll out from the pharmacies, with them making 2 to 3 visits to each one of the long-term care facilities to make sure that they get that first dose in, to make sure that they come back in a little bit later to identify any other individuals who may have been admitted or have missed that first round, and then come back in later to provide the booster dose or the second dose. And so obviously this is going to be a matter of weeks before this series of vaccinations in long-term care facilities gets completed, but we are excited that it started.
Thank you. Jennifer with Bloomberg Law, I think we have answered your question about how many people have received the vaccine. Write me back if I'm misinterpreting that. All right, next is Ronnie from the Vicksburg Daily News. And I'm going to throw this to Mr. Jim Craig. Does phase 1A include first responders? Vicksburg firefighters and EMTs are receiving vaccine.
So yes, thank you for that. It's important right now to know that we're in 1A providing vaccinations. So the focus is healthcare workers as well as that long-term care community through the partnership and also through our opportunity. Those long-term care employees that may not be able to receive the vaccine right away, that want to make an appointment to come to one of the drive-through vaccination clinics are more than welcome to come there as well. But on the first responders, if you look at it, it's those individuals that will have direct or indirect exposure to COVID patients or infectious materials. So EMS, certified emergency medical technicians and certified paramedics are definitely appropriate, but we should make sure that all of our vaccination efforts right now are focused on those critical healthcare and long-term care resources.
Okay, so we've already answered exactly how many people have been vaccinated in Mississippi. The other question is, do you need federal support? Which one of you would like to take that on?
Well, I can start off, and then Mr. Craig can kind of jump in, and certainly, one of the biggest pieces we've had with federal support is making sure that vaccine is available and allocated to us so that we can distribute it out. And I can't overestimate or underestimate how important that's been. That's been huge for us, and this is really where we need to be going with that. Certainly, we've also received federal funding to support our efforts, and I think as we roll out and we see the uptake increase, I think that we're going to be able to marshal the staff along with our healthcare partners in the state who are also going to help us distribute and administer that vaccine out as we move through the phases. Mr. Craig?
Yeah, I think you're exactly right, Dr. Byers. The support has been great, and the biggest support we need is to continue to get vaccine into our state so that we can continue these efforts around the state of Mississippi and enlarge the groups as we can. But it is so dependent on us receiving additional vaccine for us to be able to do more good in the state of Mississippi.
Okay, thank you, gentlemen. Has the Department of Health taken steps to trace those people who have received the two different types of vaccines? And will the Department of Health pursue them to make sure they take the follow-up vaccines? Dr. Byers, why don't you take this first, and then Jim Craig, you can kind of talk about the practicalities of that with the card at different sites and that kind of thing. So Dr. Byers, go ahead.
No, so that's a great question, and that brings up a great point. So when an individual is vaccinated with the Pfizer vaccine or the Moderna vaccine, it's important that they get the booster shot with the same vaccine, and the timing is different as well. So for the Pfizer vaccine, that booster shot you need to get 21 days later. For the Moderna vaccine, it's 28 days later. So it's important to track that and remember that. So when people get vaccinated, when an individual gets vaccinated, they get a card that says exactly what kind of vaccine they've been given. And we do have a system, and certainly in our immunization registry, it tells us whether an individual received the Moderna vaccine or whether an individual received the Pfizer vaccine. And so it's important for people to hold on to that card. But there's also going to be a system of reminders that will send a text message out to tell people, hey, it's time to get your vaccine. You need to make sure that you get it. Really should get it at the same place where you got the first vaccine to make sure that you get the same vaccine for the booster dose. Mr. Craig?
Yeah, the real important part is to remember that you need to get the same vaccine, the second dose that you received on the first dose. And when in the scheduling system, as people are looking to schedule that second appointment to come back and get the vaccine, it'll help guide them in the right direction. There'll be a number of reminders, as Dr. Byers said. Everyone that gets the vaccination at the drive-through locations will receive a card. It'll just be a little card like one I got already. So if they that will be their first step to know whether they're 21 days on the Pfizer, or 28 days on the Moderna product. They can also register on CDC's website with vSafe, which is a after vaccination health checker, but also has a reminder piece built into that will remind them through text message and others ways to how important it is for them to come in and get that vaccine, but also to help CDC and the community that's providing these vaccines have more information about the experience of folks that are receiving the vaccine. So it's a good tool that's out there and available on the CDC website. At the health department, some of our systems will also have some reminder pieces that'll be put out. So I think there'll be plenty of reminders that'll be made. It'll just be important for people to make those second appointments and get back in.
Okay, thank you guys. Keisha with the Clarion Ledger is asking, do you feel it is a good idea for lawmakers to begin the legislative session next week, given the current level of cases? Do you have any recommendations on how or when it might proceed safely? Dr. Byers, why don't you take this?
Absolutely. You know, we're in a time right now where we all have to proceed with caution, I think, and we all have to take those measures and put them in place to try to limit transmission as best we can. There are things that we have to do. You know, many of us have to go to work. In the coming few weeks, we'll have people going back to school. We'll have individuals going back to colleges and universities. It's important for us to be mindful to make sure that we put in place those measures to prevent transmission, not only in the workplace, but in our personal life and in our social life. And I think that, you know, over the last weeks to months, we've demonstrated that there can be some ways to accomplish things safely by making sure that you're consistently wearing a mask, making sure that you're staying 6 feet away, limiting how many people that you're interacting with in a given time. And when you have folks in a room, like a large classroom or some other large room, you make sure that those folks are separated out by 6 feet. So, you know, any activity that we do, anytime that we're interacting with other people, there is always a risk of transmission. We have so much COVID out there right now that we all have to act as if the individual that we are interacting with at any given point in time is potentially infected, and that we may be potentially infected. So we always have to take those measures in place. Jim?
No, Doc, I think you covered it really well.
Okay, so we have Megan Watkins from NBC News. Is there a plan in place for releasing your data in the future? I can tell you yes, and it will be on our website, which is healthyems.com/COVID-19. Stephen from WCBI, do you believe that the increased access to the vaccine can be used as an incentive as hospitals look to hire more nurses, healthcare workers, etc.?
Yeah, I'm not real sure about that. I can tell you right now that healthcare staff and nurses in particular are not in great supply. You know, we are using all of the staff available in hospital settings. It would be great, however, if you know, the prospect of vaccination and that protection that the vaccine could afford healthcare providers gives them a greater sense of security that they want to come back and work in those hospital and healthcare settings. I think that would be great. Jim?
Yeah, I've heard stories of especially a lot of the healthcare workers that are on the front line in these critical care wards and the ICU wards of hospitals and the COVID sections of hospitals, that when they started receiving vaccine, we're just so happy to have that opportunity to have the vaccine. It's been a long battle for a lot of the healthcare workers, so I think it's just great to know that it's here for them.
Okay, thanks, guys. Sarah would like to have the website register. Oh, can you repeat the website? Yes.
And I put it in the chat.
I was going to say covidvaccine.umc.edu. Jim, did you want to add something to that?
No, I just wanted to let you know I put it in the chat, so you can find it in the chat.
Oh, thank you very much for that. Anita, will you be publicly reporting number of vaccinations given? The answer to that would be yes, and you will find that on our website. We're going to try to provide you as much information as often as we can. Ann Snapes, all right, with the Meridian Star. How far is Mississippi along the process of vaccinating long-term care residents? I think we talked a little bit about that. Which counties or parts of the state have started to receive vaccine at long-term care facilities? Do either of you guys want to add anything?
Yeah, we're just getting started. So we activated that system back earlier in December. In the week of I think it was December 16th is when we activated the first nursing home rollout, and once we allocated doses to CVS and Walgreens, it takes them a couple of weeks to get started. So really, they're just now out getting started vaccinating those long-term care facility residents and staff. And there's a delay, like I talked about. It takes a little bit of time that once those doses are administered, to receive those into the immunization registry and get them entered. So we're going to have more data on that as we go through. But let me just tell you that all of the nursing homes in Mississippi, all 204 throughout the state, are part of that program, and all will be vaccinated with that program as we move forward.
Okay. Jim, did you have anything you want to add to that?
The only thing I will say is that CVS and Walgreens both have some information on their websites about the timeline in their vaccination efforts with the partnership, so that might be some good resources to look at if you're looking for some timelines.
Thank you. That's very helpful. Okay, Kobe from MPB. What are your thoughts on the first reported U.S. cases of the COVID-19 variant originally discovered in the UK, which we did talk about a little bit last week, showing up in Colorado? Dr. Byers?
Well, I'm first going to tell you that it's not surprising. We anticipated that it was going to be found in the United States, given the fact that it has become the predominant strain in the United Kingdom, and given the travel that is extensive between these two countries. How long it may have been in the United States is really unknown, but these are the first detections, and I anticipate that additional cases of this particular strain will be identified in the coming weeks. We have not identified one of these in Mississippi yet, but we do send samples to CDC for evaluation to determine what type of strain they are, to make sure that they haven't had this specific mutation that identifies this UK strain. We're still early in the process of learning about this strain, and I think more details will be revealed in the coming weeks. I think the big question on everybody's mind is will the vaccine cover this? Or if I've been infected before, will I have immunity to this particular strain? So far, the experts have told us that they anticipate that this will have little impact on the ability of the vaccine to be able to protect from this strain. I think those tests are ongoing and those studies are ongoing to look at that more closely. But right now, we feel relatively confident that the vaccine is going to cover that strain.
Okay, thank you, Dr. Byers. Anita from the Sun Herald. Dr. Dobbs said Mississippi will need $17 million for vaccination rollout. Do you expect funding soon? Has lack of funding caused an issue? So we've talked about this a little bit. Jim, do you want to take this?
Sure, I can. A lot of that funding is federal, and about 75% of it will come from the federal government, and that is in large part through the Stafford Act. Some of it is some grant funds to the state, but through the Stafford Act, which is a reimbursement program for a lot of our response activities. So that piece seems to be working very, very well. We continue to get that support from the federal government. The 25% piece, the legislature is aware of those requirements, and they've been very supportive of our efforts as well.
Okay, thank you. Sierra from the New York Times. How many doses have been received by the state so far? I think you guys have said that already. Let me look. Did you say, let's see. Jim, do you want to repeat that?
Yeah. So we've distributed about 120,000 doses so far, and that represents about 90% of the doses that have been allocated to us. And you know, we're working on getting those other doses out the door, even as we speak.
Yeah, our goal is always to get it out the door and in the arms of people and not waste any doses whatsoever. Kate Fish from the Jackson Jambalaya, how many doses are given to the state veteran homes? If not, when? Now, don't they have their own program for the veteran homes? Jim?
So our state veterans homes are nursing facilities within the state. They're licensed by the health department as a nursing facility. So much like the other long-term care facilities, they're receiving their doses through the partnership. I believe for all four of our homes in Mississippi, their partner has been assigned as CVS. So CVS will be working with them to get their doses administered.
Thank you. Rogelio with DAP. And we've already talked about the legislature a little bit, but I want to repeat all questions unless in case y'all have additional information. With the legislature beginning Tuesday, are there plans to inoculate the lawmakers and Capitol staff? Or will COVID testing be again offered to identify and eliminate those folks that might be COVID positive? A large minority of lawmakers are over 60, but not 75. So are they to wait until they are eligible? I would think the answer to that is yes, because our first priority is going to be healthcare workers, which are critical to our infrastructure and surviving COVID-19, and our long-term care facilities. But do you gentlemen have anything else to add?
No, absolutely right. We recognize the vulnerability of individuals who have underlying medical problems or who are older, especially those folks over the age of 65. We know that they are at higher risk for severe outcomes right now. And certainly everybody is going to have a turn as we roll this out, and we're going to do that as quickly as we can. Right now, today, the focus is on those healthcare workers in those long-term care settings. But as we move forward, we anticipate that we're going to be able to move to those people who are more vulnerable.
And just remember that we do have a few legislators that are healthcare workers. So if you do hear of a legislator that receives vaccine, he or she may be a healthcare worker.
Thank you, guys. Okay, Lauren is asking, there seems to be confusion over some basics of medical science. Can you explain in layman's terms how COVID can cause fatal problems outside of the lungs? For example, before the Louisiana congressman died, the New York Post reported he had a heart attack after a procedure.
Yeah, I can talk a little bit about that. And so we know that unlike flu, which is primarily a respiratory illness, COVID is not limited to just the respiratory system. It can affect and impact any organ system, and can have an impact on the kidneys, on the heart, and a lot of times because of that, it can lead to complications that can require hospitalization and sometimes lead to deaths. And so, you know, this is one of the reasons why those people who have those underlying chronic medical problems like diabetes that can affect many organ systems already, it can already cause some organ damage, or heart disease that can impact the heart. This is one of the reasons those folks are at higher risk for these severe outcomes. So, you know, I think it's just another illustration. COVID is not the flu. And for folks who say that this is just a bad case of the flu, it's not. It can impact any organ system in our body and can lead to complications and death.
Okay, thank you. Is there a breakdown of total doses expected to be available at sites next week in North Mississippi counties, DeSoto, Lee, Panola, and Lafayette? Mr. Craig, we did talk about this yesterday. What is the allotment? Is it the same in all the counties?
Yeah, so it is the same for each of the counties. Again, these are some of our high throughput locations. So we will have 210 appointments available each of those days that I showed at each of those locations. So for Lee County, in other words, there'll be 210 appointments available on the 2 days, each day of the 2 days next week.
Thank you. And did you mention we expect appointments to take about 10 minutes, Jim? Did you mention that?
Well, I want to temper expectations a little bit. I don't know that it'll be a 10-minute appointment. We're doing about 10 people at a time in the drive-through coming through. The process is about 10 minutes from when you enter the process and then leave the process. Other than when you get through with the vaccination, we want to monitor for medical side effects that might occur. In the lot, we'll have a lot that people will pull into for 15 minutes. And that way, if there are any adverse reactions, we can monitor and assist those individuals.
Thank you so much. All right, Kingfish from the Jackson Jambalaya. Good question. What about elderly who cannot make it to vaccination sites? Jim Craig?
So the current plan right now is to work through the vaccination sites. That's the good news for right now. We do understand that a lot of our partners, whether they're in federally qualified health centers or other places where people normally get health care, as more vaccine is available, we'll have more opportunities available.
Okay. Dr. Byers, did you want to add anything?
No, I think Mr. Craig covered it completely.
Okay. Kobe with MPB, asking on behalf of someone I interviewed this month, when might morticians and or funeral home employees qualify for the vaccine as that career has crossover with first responders and the medical field? Jim Craig?
So, it's not clearly defined yet exactly what 1B and 1C is going to be fully inclusive of. But right now, the priority is healthcare workers, those essential healthcare workers, and the long-term care facilities. The rest of it, we'll make other announcements as we know a little bit more. But they're very important. We want everybody, all the essential workers, to get the vaccination when they can. But we do have to, with a limited supply, we'll have to figure out some priorities within these groups, and not knowing what that supply is limiting what some of that conversation is right now.
And I just want to throw out a little bit of perspective too. I mean, when you look at the estimations for the number of healthcare workers or healthcare personnel that we have in the state, inclusive of those emergency medical services, we're looking at about 200,000 folks in the state that would qualify as healthcare personnel. When you add the additional long-term care residents and long-term care staff, that adds another 60,000 folks. So, we're looking at 260,000 initial doses to get healthcare workers vaccinated in the state. We're looking at potentially 500,000 doses or more to get every healthcare personnel vaccinated in the state with 2 doses. And so far, we've been able to distribute out about 120,000 doses. So you can see that we still have a process to go through as we work through the phases, and we want to make sure that we get as many people in each phase protected as we move through.
Yeah, that's very helpful.
All right, I think we need to clarify this. Any challenges out there of why 17,000 doses were administered out of the 120,000 distributed so far? So in that 120,000, that also includes our sites. These are allocations. Jim, do you want to take that on?
Well, and I think it also includes what we've allocated to long-term care facilities has to come out of that. And as Dr. Meyer said, that's 60,000, 70,000 folks that are the healthcare workers in our long-term care facilities, as well as those residents.
Yes, thank you. Rogelio, how long after either vaccine does a person have before absolutely needing the second dose? You guys had said Pfizer 21 days, Moderna 28 days. Some people might be involved with work that prevents them from taking the necessary break to receive the second dose. Dr. Byers?
No, there's some good news with that, and that is that the minimum time frame between those vaccinations needs to be 21 and 28 days. But if you go over the 21 or go over the 28 days, you still need to get vaccinated.
Thank you. Okay, Gerald with 12 News. What are the safeguards against people who pretend to be healthcare workers trying to get vaccinated? We would hope people would identify honestly. We need to get that group first. Jim Craig, you want to take that?
Yeah, a lot of healthcare workers, as a profession, they're either licensed or certified individuals, or at minimum, they'll have a healthcare facility related ID. So those will be the types of things that we'll use to verify that individuals that are licensed, certified, healthcare workers that should be at our facilities for vaccination are there. But as Liz said, we're hopeful that everyone understands the importance of healthcare workers right now getting this vaccine.
Thank you. Dr. Byers, did you want to add anything to that?
No, and we encourage folks to especially the healthcare workers, and I know that we get a lot of questions from healthcare personnel about when is it our turn? Well, this is the opportunity, and we want to make sure that those healthcare workers have the opportunity to come and get vaccinated, and know that they can sign in and get an appointment at our vaccine clinics, and they can get in and out and receive the vaccine that they need that really we've been wanting them to get for quite some time.
Okay. Sierra, will there be a way to rewatch this? Yes, we post all of our press conferences online under news and events once they are rendered. If you could please repeat how many doses have been received to this state and how many have been administered. Did you guys say 120,000?
Right, 120,000 have been distributed out in the state. Over 17,000 have been administered, and that's reported administered in our immunization register.
Right. Okay. So that number at times may be a little bit underreported.
It most likely is, yes.
Yeah. Okay. So let's see. Kingfish, with the emphasis on healthcare workers, how many healthcare workers have contracted the virus and how many have died? Do we know that off the top of our heads?
I don't have that number right off the top of my head, but I can tell you that we have had several thousand healthcare workers that have been infected in the state, and a number of them have died. But where we see a lot of our transmission early on in the pandemic, as we learned more about how this virus was transmitted, we did see some impact on healthcare workers becoming infected in the setting of providing that care. As we've done better with our personal protective equipment, and we've had broader availability, and we've learned more about the appropriate isolation and management of patients, we've seen that infections in healthcare workers is less than it was earlier on. But there's still a risk. There's still a risk that they could be exposed to those individuals in the normal course of their work, and there's still a risk that if a healthcare worker becomes infected, even if they're not infected in the workplace, even if they're not infected in the healthcare setting, that they could transmit that to the patients that they're trying to take care of. And I think that's really illustrates one of the important reasons why we want to continue to focus on these healthcare workers right now.
Thank you, Dr. Byers. Any goals of total amount vaccinated in Mississippi by end of January, end of spring? I think that's kind of a tough because it depends on so many variables. Dr. Byers, why don't you take it first?
I think it does depend on it, and a lot of it's going to depend on the uptake. And I think that we're going to have a much better idea of what the uptake is going to be and what the demand for vaccination is going to be in the healthcare community next week. So stay tuned on that.
Yeah, the only thing I'd add is, as a goal, I would love to see the opportunity for every healthcare worker in Mississippi to have that opportunity to get the COVID vaccine during the month of January. But again, as you said, it is dependent on how much vaccine we receive.
Right. It's a very fluid situation. Okay, so I am going to ask you, I don't see any more questions at this point. Mr. Jim Craig, can you make some closing comments?
Sure. I would definitely like to thank our partners. The Mississippi National Guard has been just wonderful in our testing, and we look forward to the same thing in this vaccination effort, and our partner at UMMC in developing the websites for both scheduling of testing and the scheduling of vaccine. I'd also like to remind everybody that gets the vaccine that they need to continue to do those things that Dr. Byers spoke to earlier. Follow all the current guidance, even after they've been vaccinated, to protect themselves as well as others. And those are the simple things that Dr. Dobbs and everyone's been saying all along. Wear the mask, staying at least 6 feet away from others, avoiding those crowds, a good hand hygiene, washing those hands often, following the quarantine guidance if you have an exposure to someone with COVID-19, and following any applicable workplace or school guidance that may be out there as well. And thank you, Liz.
Okay, Dr. Byers.
Yeah, thank you, Liz, and thank you, Mr. Craig. And I just want to remind everybody again that we are not out of the woods. We're talking about exciting stuff now. We're talking about vaccine, and we do have a light at the end of the tunnel. But given the amount of doses that we have to distribute and the amount of people that we need to vaccinate, this is going to be a process that we've got a light at the end of the tunnel, but it's still a long tunnel. We don't want to miss the fact that today we're reporting out over 3,000 cases, and yesterday we reported out 85 deaths. The vaccine is exciting, and we're glad to have it, and this is a step in the right direction for us as we move forward. But guys, we are not out of the woods. We are in still the worst time that we have seen so far in this pandemic, and we are not seeing any signs really that things are slowing down. And we are still in the middle of the holidays. I would encourage everybody, please, for New Year's, keep it small, keep it nuclear. Avoid those social gatherings. Make sure that you're wearing a mask when you're out doing your essential activities. Please, for the good of folks, and we know that every case can translate into hospitalization. It can translate into deaths. We want to try to limit that while we are waiting for the vaccine to continue to roll out. We have some opportunities to still work on reducing transmission with those things that we know have worked in the past.
Thank you. I did want to say one thing to the media. We have enjoyed great relationships with all of you, and you all do a great job getting the information out to the public. I had an unfortunate incident on Monday where a reporter went into the county health department and took pictures, which is highly prohibited. You can get, as we do testing and as we do these vaccinations, you can get wide shots standing off the property. If you find folks as they're driving away that want to talk to you, that's fine. But we do not allow reporters on the premises or anywhere where we are providing vaccinations. And definitely you can't take pictures, and this is because of HIPAA. This was a very young, inexperienced reporter, so I know that wouldn't happen with you all who are on the call, but I just want to thank you for your cooperation always, and we'll try to help you any way we can. And with that, I'm going to say Happy New Year to everyone, and have a great day.